Hello to our viewers and listeners. Thank you for your patience as it's been a while since we last uploaded an episode. Today's episode was recorded a couple of months ago during the height of the third wave in Ontario. While things have improved since then and our vaccination rates are amongst the highest in the world, experts are still warning us about a potential fourth wave. So while some information may seem old, nonetheless, we feel it's important to share our guests' experience as an emergency physician, as well as what we could do to learn and avoid a potential fourth wave. This is also our last episode of Season 2. We'll be back with some more fun and insightful episodes in a couple of months' time, and we promise we'll be more on schedule. Until then, please enjoy the episodes we've already published. Please share and subscribe to our YouTube channel and on Spotify, Apple, and Google Podcasts. Your feedback is very important to us, so please write us at futureof19@gmail.com. We're also in the process of updating our website, so please stay tuned for futureof19.com. Happy listening.
Hello, everybody, and welcome to an episode and a new episode of the Future of. It's Vasily Papadopoulos here, and hello to all of our listeners. Today's episode is going to be a different one and a special one, given the extraordinary times that we are living in. We're a year and a half into a global pandemic, and here in Ontario, we are sort of experiencing or going through the worst of that pandemic. And we thought it was important for us to be able to speak to some important and very valuable people that have really helped from a societal perspective, from a health perspective, support everything that's possible for us to get out of this pandemic in a way that's healthy, safe, and supportive of our healthcare system. And so today I want to introduce Dr. Andrew Park. He's an emergency physician at London Health Science Centre, and he's also an assistant professor at the Schulich School of Medicine. Andrew is also a friend. I had the pleasure and honor of doing our MBA, not necessarily together, but in parallel classes, as well as doing a class trip to Vietnam together. So Andrew, welcome, and thank you so much for joining us today.
Thank you for having me.
Great. So why don't we start? We know, these are extraordinary times. I think when we look back in history, no one was prepared for something as global and as devastating as what we're going through. And I think you have a very unique perspective. You are an emergency physician, a trained doctor. You also now have your executive MBA from Ivey Business School. And so I thought maybe just to kick off and to start off, Andrew, what drove you personally to get into medicine, and how did you end up becoming a medical doctor?
So I'm the son of Korean immigrant parents who came to the country with very little. And education was always the ticket out, and so certainly it's always the particularly the Asian dream, have their kid, especially their son, become a physician. So certainly I was always guided there by my parents. But fortunate for them and for me, like it's been something that I've really come to love and have a passion for, and think about it in a different way than I think is conventional in a lot of ways. So it's always been that the education was a key to getting kind of our family and our situation out of poverty, basically. And I was very fortunate and able to do that. It's been something that's been an amazing journey. I've been across the country in my training, and it's been a blast.
And I guess you're the first person in your family to become a doctor. Like you wouldn't have had a precedent. Like there was nobody in your family prior to that in the medical field.
So on both sides of the family, I was the first one to become a medical doctor. my parents, as I said, like education was everything for them. So I think I calculated between my sisters and I have two older sisters, so I'm the youngest. But between the three of us, I think we have a combined 44 years of post-secondary education. So it
Wow. Wow. I know you alone. Maybe I'm wrong. I think you have 4 or 5 degrees. Am I correct? Yeah.
I think four degrees and 2 diplomas.
Okay.
So yeah,
and nonetheless, extremely impressive.
Yeah, 15 years. It's been an expensive journey for sure.
Absolutely, absolutely. And so for you, I know you're, an emergency physician in a very busy hospital in London, Ontario. What has it been like to be an emergency physician during a global pandemic?
Chaotic. I mean, it's I think the one thing is that we're really lucky to be physicians in general. I think that we have a job of service to the public, but I'm realistic about and pragmatic about what I do, and I think that other people have had to shut down, stay home, do all sorts of things that have like completely disrupted their lives. And first of all, I haven't had to experience that. So from that perspective, I'm really lucky. But in terms of the job disruption itself, it's been huge at times and minimal at others. When this whole thing started, we were just waiting for that crush. We thought we were going to be New York, Italy, Seattle. We're worried, like we're human too, and we go through the same things about like, how am I going to choose or tell someone that I can't vent their dad or mom and they're going to have to die? Like, can I go through that? And that was really emotional for a lot of us. And then nothing happened. It was just, everything got really quiet, and it was eerily quiet for us. But then things started to pick up again, and then the world started resuming, and then the second and third wave is where we really have felt it. And so we go through the same things that the general public goes through in terms of their job, in terms of the disruption, the uncertainty for the most part. But as I said, we're thankful to have our jobs and to continue to be able to work and to serve the public.
And so what would a typical day be for you? I mean, like what's your shift like? How many hours are you working? Like what would you do daily, right?
So the job of an emergency doctor is very much like a sprint. We're certainly not marathon runners. We go in, we do our thing, and then we get out. Our shifts range from anywhere from 6 to 8 hours. It's not atypical to spend an hour after your shift wrapping up and kind of tidying up what you have to do and paperwork and et cetera. But so it's about 6 to 8 hours. And it's just very, I mean, our first shift in a 24-hour clock starts at 4 a.m. and the last one starts at 11:30 based on my schedule. So, and anywhere in between there are 6 to 8 hour shifts scattered throughout the day. And so it's the biggest disruption for me is certainly like my sleep schedule and just being able to sleep on the fly. Like my kids are always saying, "You're always tired."
Yeah.
certainly, I think that going through the pandemic has made all of us more tired than general. But that's the big thing is you have odd work hours. You're constantly like figuring out when you're going to sleep, eat, exercise, be with your kids, spend time with your family, and that's a pretty typical day. So on a work day, I try to eat 3 meals in a 24-hour clock, which sometimes can be really like odd times where I'm eating like a dinner or a breakfast at 2:30 in the morning. And then I get ready, I go to work, and I just start the cycle of PPE after PPE.
Yeah,
And,
I was going to actually ask. So, I mean, what are some of the precautionary measures or things you have to do differently because you are dealing with a virus that is very contagious? I assume, I think you're vaccinated or fully vaccinated at this point. You are, right? But there's always that risk factors. So what's different now in terms of how you would have sort of, handled yourself? What do you have to wear physically on a day-to-day basis during COVID?
Yeah, so different emerge docs wear different clothes. Some wear like shirts and pants, and like, whereas I've always worn scrubs. I think there's an attraction to going to work in your pajamas and not really worried about what to put on.
Right.
So I've always worn scrubs. I do wear a scrub cap now, which was not what I would have worn before. Instead of glasses, I wear safety goggles, and I'm fully masked. So really, all you're seeing is like basically, from here to here. So basically, what you're seeing now, except not my nose and mouth, and that was not typical. So like, patients would be able to identify with us through our facial expressions a lot more differently. And you've had to adapt to that in a way, from an emotional standpoint, to connect with your patients in a way that we didn't really have to before, because of how profound, facial expression and connection with our patients was. And then for, I would say, like, about 80% of our patients, the guy who like stubs his toe or something like that doesn't need full PPE, but we have a very low threshold for otherwise wearing a gown and full gloves. For the most part, I used to wear gloves for most patients. But now we're like fully gowned and gloved and masked for almost everybody, and that's been a huge difference. We like to think we're fastidious about washing our hands, but typically we're not. You get busy and whatnot, but now it's just every single patient, every single time you're thinking about it all the time. So it's always top of mind, and it's always there. You're always hot in your PPE. But that's
okay. And you're wearing it for such extended period of time as well. And
yeah, sometimes you're wearing an N95 for 4 to 6 hours at a time, and that, like, the N95s, they're like, it's like wearing they feel like you're wearing like a wool face mask that's like tight to your face. So it's not comfortable.
I was going to say, that doesn't sound comfortable at all.
No, it's not comfortable at all.
And what about the process? So I understand, when you're there in the workplace, like, what happens when you come back home? Because I know you've got young children, you've got a wife, you've got a house. Is there anything different that you've had to do to and from your house?
Yeah, I used to be pretty, maybe cavalier is the wrong word, but certainly like laid back about it, in terms of like, I'd come home, sit on the couch, kind of do that kind of stuff. But certainly with the pandemic, I go straight to the shower. I don't hug my kids. They know, and that's kind of tough, because your kids haven't seen you all day. They want to come and see, but they just know, like, I haven't showered yet, so I go straight into the shower, give myself a really good washing, and especially any place that's been exposed, certainly, like especially my face, my neck, my arms. And that's not something I was used to for the first 13 and a half years of my career. So that's been a big difference, but it's probably the right thing to do anyways. So it was something I was like, it was probably something I should continue to do for the rest of my career. So it's simple things like that I'm like, this has probably kept me from getting sick. It's probably kept my family from getting sick, and it's probably something I should do more often.
Yeah. So I wanted to actually press upon that. You raised something interesting. You said that, these are all sort of new protocols, but you think maybe they're ones that you would adopt long term. And do you think that's something, like, not only just within the medical field, but even long term for us as the general population, like wearing masks more, being a lot more careful when it comes to germs and whatnot?
Yeah, I think it's a real balance in the society of saying, like, not to hug, not to touch, not to have that physical human connection, with saying, the idea of a mask is the idea of communal concern. They wear masks in Asia all the time, and I'm of an Asian background. I mean, my parents are Korean. I went to Korea and I was like, what is with these people? They're all crazy. Like,
but it was Andrew, was also the same when we were in Vietnam.
Well, I know,
right?
Right?
Like, I mean,
Totally.
I remember everywhere we were in Vietnam, it was like, it was standard for people to wear masks.
Exactly.
Like,
They're wearing it for one of two reasons in Vietnam. They either wear it because they're sick or because of the exhaust fumes from all the taxis, right? The motorcycles. But I mean, it was something that, like, especially after SARS-1, I was in Toronto during SARS-1, and I experienced that kind of that fear and the mistrust of any Asian wearing a mask. And I remember thinking, like, that just makes sense. I don't really understand. And it seemed like we were really slow to either adopt it or understand it, or it needed to be thoroughly explained out and vetted out for us. Whereas in Asia, it was just something to do. And I think now that we're over that hump, it's something that just kind of makes sense. And I think we're used to seeing everyone wearing a mask. I don't think it's got that same stigma that you, like, again, of Asian Canadian descent. And I look at it like, and I'm like, what do you do? But now I'm like, oh, okay, that actually makes sense. And when you understand it, and certainly having been through a pandemic ourselves now, it just makes intuitive sense. So I could see something like that certainly being the norm. The only problem with something like that is it might stigmatize someone who does have a sniffly nose or something like that. So, I think we're much more sensitive about individual freedoms and rights, which is important, clearly. But that is something that I could see being a mainstay.
Interesting. I was wondering if you had, or if you wanted to maybe expand upon your any personal experiences you had the last year dealing with patients, or any of your sort of, colleagues or medical professionals during this time.
The one thing that I think we're all experiencing universally is that and I mean, I experience this at home myself, but I think, I'm in a better position to cope and handle them than a lot of people who maybe don't have jobs or don't have families. It is just that basal level of, like, societal stress is higher on every level. Every single person has that. Like, there are very few people who are wishing for the next pandemic, right? Because of what it's done to us as a society. The mental health, the marginalized population, as they tend to do in any major event, always suffer disproportionately to everybody else. And that is something that, like, one of the hospitals I work at 4 different hospitals, each with very different kind of populations. And one of the populations that we work with is homeless and addictions and psychiatry. And that hospital seemed to maintain their level of those patients. Like, that patient population never seemed, because they had nowhere else to go, right? So the hospital in a lot of cases was their refuge. It was their place that they would go for X, Y, or Z. And that never changed throughout the pandemic. It just seemed to get worse. And so that was an experience of like, I'm going into my 15th year of practice, and certainly I've had patients who, varying backgrounds. I've treated gang members, I've treated cops, I've treated, drunken bar fights, and all the whole gamut of, and I've never really felt like personally that in danger. But this year, like, I've been kicked, I've been tackled, like, once. And that's something that's never happened to me in my career. And I think that's probably attributable to that level of stress.
Yeah, I was going to say, is that where that sort of unknown fear factor, that's those societal pressures that are sort of manifesting themselves when people come, I guess, to the hospital, right? Because
yeah, no, totally. Because I think that like shelters are a huge place of, like, infection spread, and so they're doing their level best with, like, not enough resources in the community, dealing with a very challenging population, and so they're under-resourced, understaffed, likely underpaid, et cetera, with not enough of everything. And so that impacts the clientele that they're trying to work with and help and design to help. And so they feel that pinch. So the pinch works downstream on every level, and that manifests in ways that I think are unmeasurable, but certainly exist in a way that we all acknowledge. I've had colleagues who have gone off on stress. I've had I've had other colleagues get assaulted too, which is, like, unusual for the most part. Like, again, we work in a pretty, like, unpredictable environment. But never have I felt like this degree of like, am I in danger here? Kind of like spidey sense, right? As I have this year.
Wow. And so from that, like, are there any sort of key learnings? Like, are there things that maybe you've learned in the last year and a half that you could say, this is where, the healthcare system is heading. These are some of the things we need to look for. And also here are some of the things that we've learned that we know we can change or do better, or maybe in the process you've pivoted and have figured out, hey, this is a better way to do something.
Yeah, I've always been of the mind that what we do is service oriented. In order to be of use, or not of use, but like to be our best selves as a healthcare system, our main driver has to be what benefits our patients. In order to do that, it requires like a high degree of like compassion and empathy in order to do our jobs well. I think that I think I feel that more than any other time, because more than any other time, I can't help people. I can't provide the care that they need because either like clinics are shut down, or services are being withdrawn, or some are being added, et cetera, et cetera. But the matrix or the mix of the services that we're providing sometimes change, and sometimes it's not to the benefit of our patients always. And I can understand why it evolves that way, but we got it wrong for whatever reason. And so we have to be, understanding of where our patients are coming from, and try to dedicate our services and our service mix towards improving the care for them. It's always got to be with patients first. It can't be, and there's always going to be provider, system, and patient factors, but the patients kind of, they kind of rule that. So in terms of like developing, and in terms of developing for the future, like I'm always of the mind that being comfortable with change, and being comfortable with the change in the way we think things through and see things through is really important in healthcare. We're typically very, very slow to the game in terms of change, or have a trouble managing that process. So I think just to be, to be a bit more nimble, to be a bit more flexible, and to see the world in a different way, it will be really, really critical for our healthcare going into the future.
That's a really good takeaway. And how about if you are able to also expand upon, maybe for you, either maybe personally or professionally, what's been sort of the most challenging aspect of your role during this past year and a half?
I mean, professionally, it's not been terrible for me overall. We're used to gloving and gowning and wearing full PPE. It's just not for every patient. We might do it once every shift or once every other shift. So it's not like this is completely foreign to us. But professionally, it's like hearing about doctors and nurses dying in Italy, and in New York, and just how they're breaking down, and that impacted us. I mean, a lot of my colleagues, I know I did, like made sure my life insurance policies were up to date, just in case, made sure that my disability, like, because my wife's at home with 3 kids, and I just wanted to make sure that my family would be taken care of in the event of, and I've never had to think through something like that. I've been doing this job for like 14 years now, and I've never thought through that process, but this was like, I made sure that everything was like airtight on that regard. And not a lot of people can say that that's the one thing that they thought of for their jobs, right? Because I was thinking, now there's a death rate associated with my job,
Right.
and that was scary, right? From a personal standpoint, I mean, I struggle with the same things that everyone else struggles with, like homeschooling 2 kids with like a 2-year-old running around, like jumping on everything and closing their computers.
And now they're all online, right? So no one's, or
Yeah, and they're online now. So,
oh yes, yeah.
like, we've had to, and all that, like the vast majority of that burden has fallen on my wife. And I wouldn't be able to do what I do without her kind of being like supportive and helping, keep the ship afloat, kind of thing. But like everything else, it stretched us in ways that we didn't really anticipate coming into 2020, right? And let alone 2021.
Yeah.
My daughters had some like real anxieties. One of my other daughters was crying because she said she was going to miss me when I died. Like, and I don't talk to her about me dying. I don't talk to her about like a death rate associated with my
Right.
job. Like, these aren't things I talk to my 5-year-old about. But I do wonder, and I've talked to other colleagues whose kids have expressed the same fears, and I do wonder if I'm just projecting something different. Kids are your ultimate truth serum, and I think that um, I think there must be something that I'm projecting that's coming across. It's like, I'm coming home maybe a bit more stressed, or so it's all like how your professional and personal life mixes. It's not. It's impossible to hide it completely, I think.
Yeah, that's interesting. But I also think too, like in the case of your daughter, and I assume for a lot of children, having to go through this pandemic is really hard for them. And I think they
Mhm.
also absorb, like they're sponges. I think they also absorb what they hear, and not only, maybe sensing the stress you have, but also their surroundings and having to
Yeah,
deal with that constant change, because children just want consistency. And
for
so,
sure.
that's where they probably come up with these ideas of, oh no, daddy's in danger, or however that is,
Mm,
I guess, whatever their mechanisms are. But they're harder for us to decipher because they're kids and they just can't
mhm.
articulate it as much.
And
Um,
they don't understand like the death toll, the numbers. So they just,
no,
all they
no.
really understand is that, am I going somewhere?
Mm.
Right. And so it, like my oldest daughter would ask me every day, did you see COVID? How much COVID did you see? Were they really
Oh,
sick? And she's like, she was 6, just turned 7 like a couple of weeks ago, right? So, and she was just obsessed with this idea of COVID, and it's really hit her hard, um, with the knowledge that of me going to work, of me doing what I do, and whatnot. So, but yeah, you're right. Like it's really impacted kids, and I think that's one thing that we're gonna have to adjust as a society. 'Cause I
mm.
just wonder, like how much are they gonna remember, and what is this gonna be like for them in the future, and how do we get back to, and maybe we don't want to, but how do we get them back to a healthy state of mental health and well-being? I don't know the answer, but I think for some kids it's going to be really rocky. And as again,
Yeah.
the kids with the fewest resources are going to be the ones that struggle the most. They're now like 2 years behind in their learning, and that's going to really suck. That's going to be something we got to figure out, I think.
Yeah, and that's interesting because it was sort of one of the questions I had was, experience a health crisis or a pandemic at this level or this scale. Like, what does it mean, in your opinion, for the healthcare system moving forward?
um, the one thing I say about COVID, that is not necessarily a bad thing. That I think when you get into any job, you get into like the stable pattern of existence, and you just kind of go day to day, and like the wheels keep turning. The lights are on, and then like there's your day. You start, you finish. And no one really questions what happens between the hours of opening and closing a plant or an office, or in this case, a healthcare system. um, COVID has been the greatest, and I don't say it as a good thing, but the biggest referendum on every single aspect of every single thing that we do in the healthcare
Mm.
system. Like everything else, it's why do we have to be in the office when I don't really do anything in the office, right? Like,
Right. Okay.
like companies are bringing down their real estate footprint. Healthcare is the exact same way. Like, we're asking ourselves, why do we do this? It seems like we're duplicating a lot of processes. And because we were so focused, so vigilant on saying we don't want patients coming to the hospital 3, 4, 5 times to get 2 things done, let's get it all done at once. It really made us think about like how we can, on an individual level, make our process more efficient. Um, I've always been like I was a chief of a like a middle-sized department that we were very busy out in BC. And my entire goal was efficiency, efficiency, efficiency. How can we do this better so that our patients don't have to wait as long? That they understand what the wait times are. How do we get this so that we're serving them better, so that they don't have to say their story 18 times if they finally, et cetera, et cetera.
Mm.
But it was a hard sell. Like these were things that like people were like, well, you know, a lot of people have to ask them what's going on. I'm like, but can't we just all listen at the same time? Like, I don't really understand. And it's just simple. It's a simple question. And now with COVID, we're like, we should really stop like getting them to repeat their story like multiple times. And we really started doing that on every single level. And I think that's where
That's actually true. When you do go to a hospital, you do
Totally,
end up
it's
telling
true.
your story or what you think
Yeah.
your issues are repeatedly.
And it's not
That's
like it's
that's
changed
an
from the
interesting
first to the
point.
fifth person, right?
Right. Yeah. Yeah.
It's still, you're still
Yeah.
the same person. So, you know, it's so like little inefficiencies like that. And I think this is where like, this is where I think we were going to see some incredible innovation, because now, like, you know, before everyone was like being dragged through innovation in healthcare. It was almost like a chore to be dragged through this innovation. But now that
Yes.
everyone has to be like their own, like, they have to be an innovator of their own domain. Now they have to each it's incumbent on each individual to try to prevent multiple movements to the system. They've changed their practice in ways that are like, oh, you know, I was doing all this like needless stuff, and now I'm much more efficient. I can process, you know, patients a little bit better. I can, you know, and to our own selves, like I can get home on time. I can be like present for my family. I can be, you know, a better person for myself, so I can be a better physician for my patients. All these things really come into it. And I think COVID has highlighted that. My big hope for healthcare is that it makes us comfortable with the idea of change.
Mm.
Um, I have kind of my own kind of personal philosophy that, and it's something that I've seen in healthcare over and over again, that the words like "this is how we've always done things" are completely valid excuse, like a completely valid excuse for doing completely crappy things. And I think
I would have to concur with that. So
I don't think
absolutely.
that's just
Yeah.
medicine, right? But I think
No, I think
in a
that's across the
job,
board. You're right.
exactly. But in a
Yeah.
job that really impacts people in a way that can be like lasting in huge ways, I think we got to get over that. And I think like the simple question of why is good enough to
Mm.
disrupt that. And it's always been, it's just now we've been forced, like the gauntlet's been thrown down on us, and it's been like we have no choice but to ask why. And that's been refreshing to see a bit of that like process start. And I'm hopeful, I'm really hopeful that that is something that actually continues, that we're able to innovate and improve the way we do our processes.
That's great to know. So this is actually great because it kind of segues into another area I wanted to ask you about, and that was like, what did you think the healthcare system generally did right during the pandemic? And then what could have been handled better? Or actually, like, let's not even make it a sort of a negative thing, but what, to your point, could we kind of do moving forward? I mean, you've touched a bit upon that, but really for me, I want to know it's what did we get right? And what are the things that were sort of aha moments? These are the things that we need to fundamentally change, if we, let's say, wherever we ever need to have to anticipate another pandemic or another large sort of healthcare crisis.
Mm-hmm. So a couple things, like as I said to you kind of earlier, like I'm reluctant to wade into the political form of things. However, I will say this: it's that people have to realize that it's really easy to be critical of Doug Ford, whoever, Justin Trudeau, and again, without like, those are in the same job, and that's to take care of Canadians. I think that people have to understand that there is a mortality rate associated with complete economic shutdowns. And I think that's a really challenging thing to say. Behind door one is a pandemic death rate, and behind door two is economic homeless, the vulnerable death rates associated with that. So which do you choose, and how do you balance that? And the incredible amount of pressure that's placed on these guys to do that job is absolutely astounding. Like it wouldn't surprise me if they've lost years of their lives, literally, to this pandemic. And so I think that's the one thing that we all have to kind of recognize and be, as a general commentary, maybe, a bit more patient with our leaders about this, without still saying that there's a lack of accountability. I think there is a real balance there, right? But that's an aside. In terms of what I think we did really well. I mean, I think for the most part, like, I have always felt fairly safe on the front lines of healthcare. We consider ourselves, especially in the emergency department, to be that tip of the spear. And for the most part, there was some concern about a stable supply of PPE. But we feel that they have done everything they can to put us in a place to succeed and be successful. All of our emergency departments have been completely renovated. I mean, in general, you can't like hang a plaque on a wall without like services in hospitals like taking like 6 weeks to get back to you about changing a doorknob or something. But like overnight, there are field hospitals that popped up. There are like, emergency departments were completely like, renovated. And that was something that I think we did really well. I think we mobilized that area of the healthcare system really well. I think that there, again, as someone, I don't purport myself to be an epidemiologist or a public health expert, but certainly I think there are certain things that I felt were like, maybe we did this differently, or because it had promise. The one area would be contact tracing to me. Like, I wonder if there's a way that we could do a contact, because we had the app, but the app was voluntary and it only worked if you turned it on. So, and I see the experience in South Korea where everybody had it. Like, it was so technologically advanced.
Mm-hmm.
They really utilized the technology to make like an incredible impact to their society over something that was relatively easy, because everyone has a cell phone, right? So I think that's something maybe that we could have leveraged a little bit more. And like I've alluded to in the past, like, I think that it's just the forgotten people are always going to be the forgotten people. And I think that it's a story to tell that you made sure everyone on the front lines was taken care of, but we forgot about, like, the grocery clerks, the cleaners, and the people that truly keep like things going. And certainly beyond that, like, the mental health, the homeless, the addictions. And I think we underestimated the whole thing, but certainly the impact that it would have on our mental health as a collective society. I mean, you see wellness apps popping up all over the place now, right? I think there's a reason for that, right? Because people are really saying, like, we need this. And in the future, like going forward, it's just, I don't know how we dig ourselves out of that. I don't think that's going to be a simple thing to dig ourselves out of.
Right. And I think the other thing too, you had talked about when we had said, like, what do you see changing moving forward when it comes to the healthcare system? You mentioned just being able to deal with regular change and not doing things the way that we've always done them. And I think also too, like, for me, I think there's a need for this rapid digitization of the healthcare field. And I think, to your point, Andrew, for years we've always struggled, at least here in Ontario, to make things digital, make things online. And do you think like that's really something the healthcare system will really need to embrace moving forward, is to kind of expedite maybe some of these old legacy systems and really get them to the point where you had mentioned contact tracing, an easier way to book vaccines, or there's a better way to access your records. I know, like, if I had people who got sick during the pandemic, not related to COVID, but you needed medical help. And as opposed to going to a clinic, you did like an Ehealth sort of session. And I thought, well, that's interesting. Like, maybe that's more of the stuff that we need to do to kind of expedite this change, or at least support it. Oh.
Yeah, no, I think for sure. I think virtual health is going to be something that is going to be ubiquitous in the next 15, 20 years. I think the notion that patients go to physicians, and I mean, we're a very provider-centric system. Like, you go to the hospital doesn't come to you, right?
Right.
And I think that's going to change. I think that has to change. But it has to change. It's the hub, like the hub and spoke type, like model of healthcare is very similar to like the airline industry and how like WestJet in a sense disrupted that, right? And I think there's similar, like not necessarily the WestJet Air Canada modeling healthcare, but I think there's similar disruptions to be made that can, and it's going to take a lot of thought, but like can be cost effective, can be patient centered, and can provide the providers with the ability for more convenience, right? So I can sit at my home and talk to patients without, you know, traveling to work. And now this makes me much more portable, and I can go see patients, you know, from here to the, you know, Sudbury, kind of thing. And that's something that I think we have to leverage. But the downside to that is that it becomes, it is a liability piece, and the physicians are always like, providers are always concerned about liability. So it might actually turn out that increases healthcare utilization, because we say, well, I don't really know, go to the emergency, because we're seeing a lot of that now. We're seeing like, you know, oh, they talk to me and say, you need to go to the emergency department. And again, so it is something that we have to be very careful with, and it's nuanced, but certainly the way forward is going to have some virtual component of healthcare, and I think that's critical. I see patients like texting their doctors now and stuff like that through these apps, and I think that's fantastic.
Yeah, I actually used like an Ehealth. You know, I needed to speak to a doctor, and then they called me, then we did a session, and then it was all taken care of. And I thought, wow, that's fascinating. Because typically you'd have to go to a clinic, you'd have to book an appointment, you sit there waiting in the waiting room. You know, sometimes you're waiting an hour plus, you never know when they're going to see you. And so I like what you talk about, how it, you know, it's still provider first, but it's sort of like we've always had to come to this healthcare system as opposed to the system coming to us. So.
And there are enormous savings that can be had. Like we have patients, like, because we're a regional referral center, we get patients coming from Owen Sound, from Windsor, like, you know, these are like 1.5 hour, 2 hour drives for like a 70, 80-year-olds. Like, you know, so you're spending like 4 or 5 hours on the road, plus 2-3 hours waiting, plus an hour in the clinic. Like, you know, that's not nothing on someone who's A, senior elderly, B, a working parent, C, a young professional. It doesn't matter what you are, like spending 7-8 hours when you're already like taxed medically clearly because you need a regional referral center to do that kind of stuff. It takes a lot out of you. And I think we can strike that balance. I really do. Yeah. And I think the thing is we've been really reluctant to do so because it's taking control away from us as a system, right? But I think that we underestimate our patients, and I think we underestimate their needs. So we think we have it figured out, but I think that when you eliminate that, patients are much more like grateful that, you know, when patients wait less and you're more efficient with how you process them, their demand on you actually goes down.
Exactly. And Andrew, probably their stress too, right?
Right, exactly.
Right. So then you're dealing with less stressed patients, you know, much more understanding. Because you're right, there's nothing more annoying than waiting 2 hours for a doctor to see you.
Totally, right?
Right.
Like, you know, like I have patients that wait, I mean, we don't hit like 8 to 12 hours routinely, but like, you know, 4 to 5 to 6 is not like uncommon. And I'm like, when do you wait in society for anything that long? Like ever? Like, I don't know, like to go to like a concert, you're waiting in line overnight. You're one of those guys. I don't know.
But that's fun, right?
But that you're getting something out of but like something that's good. I don't know. Like for me, like I always wonder, like, and you know, the amazing thing, and this is what I mean by we underestimate our patients, is that in a day of 30 people or 20 people, however many you see, like 95% are like completely grateful. They say thank you. You know, no one says it's I would say like 5 to 10% of our patients say like, what took you so long? I've been waiting forever. And you know, and they impact us disproportionate to the other 90 to 95% who are grateful, say thank you after waiting 6 hours and being told they're not going to die and they have nothing wrong with them and they can go home. You know, the other 5% will say, well, you did nothing for me. But the other 95% say, you know, you told me I wasn't going to die, and that's good enough for me. Right. But we always remember like the 5%, right?
Yeah.
The negative interaction. So it is one of those things. I think we underestimate our patient population. They're much more grateful and more willing to work within our constraints and with us than it's that, they're either a burden on us or that, that we have the control. I think neither of those things are true.
Yeah, and from what it sounds like, wow, we're a lot more agile as parents, like as patients, excuse me, a lot more agile as patients than maybe the healthcare system thinks that we are. And so that's probably a great takeaway at the end of the day.
I think that is changing now in like amazing ways. Like I was part of I was part of looking through like one of the Ontario Health teams, and I think the way that they set up the Ontario Health teams seems promising. They're regional teams that are made up of like patient advocacy, like different like community members to help design, drive innovation in the system that helps patient movement and patients, like they have seamless access to their own information, their data. And I think like, I'm sure there have been other systems that have like done it or have like been conceptualized that we're hopeful to do well, but this is one that I actually have a ton of hope for, because I think that there's if done well can really change the paradigm, because they're pushing towards virtual health. They're pushing towards meeting the patients on their grounds, on their turf, and they're being designed by people in the community. They're not being just designed by like healthcare engineers and physicians and nurse administrators, which was kind of the traditional route because we know the system the best, right? But we were kind of for not that we were always forgetting, but this time they're a player at the table, so we can't forget them. They're there.
Yeah,
they're ubiquitous in their decision making.
I think that's a very, very good learning.
Yeah.
And so ultimately, how do you see us living with COVID moving forward? Because I don't think COVID's going away, right? I mean, it's here as a virus. We're all getting vaccinated. We're going to have to learn how to sort of live with it. But you, as a sort of a physician, like how do you see us living with it moving forward?
So I think the impacts of identifying and understanding infectious disease on like an individual societal level will be at an all-time high, like, for better and for worse. But I think that the average individual has a renewed kind of or a new sense of what it means to be sick or ill, confronting their own mortality on levels that we've never had before. And my hope is, as somewhat of an eternal optimist, that makes us more understanding of each other and each other's situation, and certainly more willing to kind of come together to prevent general catastrophes on multiple levels, within your workplace, within your family, within society in general. Again, it's kind of like that good news, bad news thing where you like 90% of it's good and 10% of it's bad, because we see a lot of like this 10% like of this like segment of the population that really isn't overly willing to play along, I guess, in the sandbox. And I think that's pushed us to understand where they're coming from. And I think you kind of have that reaction of like, well, they're not worth it, or like maybe we should try to understand where this is coming from. And so I'm hopeful that understanding comes through in general on different levels of society. From an infection standpoint, I think we're just more comfortable now after like a year and a half into this, with the idea that people get sick, and we have to understand and respect those boundaries and be able to protect ourselves, our family, and things like hand sanitizer in public school, I don't think is ever going away.
Yeah.
And that's a great thing, right?
Right.
Because, maybe we just don't need our kids being sick, 21 days out of every year, because that impacts their learning, et cetera.
Right. Or things like better ventilation, the way schools are set up, like how do you manage germs and all of that? Because
Totally.
I mean, the one takeaway for me has been, because we've all been so careful, I don't know anyone that had the flu this year.
No.
Or that's really become sick through germs. And so for me, that's like, wow, that's a good takeaway. It's like, maybe that's where we have to up our game in terms of how we manage ourselves and our health and just our hygiene generally.
Yeah, totally. Like hand washing, it works. Do
Right,
it.
right. Hey.
Like whenever I talk to people, they're like, I wash my hands like 100 times a day. I'm like, no, you don't. You don't know what that's like. You really don't, right?
Oh, that's you. That's not me or anything.
Right. But that's the thing. The average person doesn't know what it's like, right? Because we overestimate the number of times, and by average, I mean physicians and nurses too. Like, we overestimate the number of times that we do, and if we did all the time, like we have been for the last year, we wouldn't be getting as sick, And in the last year, right, we haven't seen like diseases like the flu, which aren't as transmissible as COVID, and so it's been great. Like, I honestly never would have thought that I would have seen a year of my life in my lifetime that we didn't, like, I almost saw basically no flu. Now COVID's obviously a lot worse, but I mean, if we don't have COVID and we're able to maintain like a relatively flu-less season, I mean, that's massive. So we've done a lot of really good things in this regard, and I think that's something, the vaccination thing, it wouldn't surprise me if this is something that we're having a conversation about again next year. It wouldn't surprise me at all. And so it'll be interesting to see where our vaccine reticence goes, whether it increases or whether people are more comfortable with it, and just, vaccine passports. Like, it'll be, I've heard of, the EU kind of wanting to institute that for travelers from North America.
Yeah, I also think I just read an article today saying Canada will do the same. I think
it wouldn't surprise me from a protectionist standpoint. The governments would say, like, we want to do what's in the best interest, and that is if you haven't had the vaccine. So it's interesting because even in that, it segregates out different sections of your population and your society that may have access to things that others don't, and that, like, for whatever reason, whether they chose not to or whether they didn't have access to it. So I think that'll open up a whole like world of conversation and discussion around how we do this without, again, marginalizing or diminishing segments of our population.
Yeah, that's fair. Well, Andrew, thank you so much. This was really helpful. It was a great conversation. I hope you enjoyed it as well. Before we wrap up, we tend to ask our guests 2 fun questions, so we can conclude. So the 2 questions are, is there anything fun or interesting that you are reading or have read, even given your crazy work schedule? And anything that you've watched or any show like on a Netflix or an Amazon that you would recommend in terms of watching?
Oh, that's a great question. I watched, I can't remember what it was, but it was a David Attenborough special about his time and career, and on Netflix. That was amazing. That guy is absolutely incredible at 94 to be continuing to
right, that's right. He's in his 90s, is he not? Yeah, okay. Yeah, I think something like that. Yeah.
Sir David Attenborough. No, that was absolutely phenomenal. And I think everybody should watch that. I have gotten more into podcasts myself, like listening to them, and we did a lot of Harvard Business Review in our MBA. But the Harvard Business Review Idea Cast is absolutely phenomenal.
I listened to that too. It's great.
So
yeah,
good.
yeah. Their series on leadership is done really well.
Excellent. So good. So I listened to A16Z, which is like a Silicon Valley kind of tech group, and they touch a lot of different topics. They just did one on crypto that was like, if people are like, what is crypto? I don't really understand. They just did one that was like amazing. That's like so good and speaks to like kind of the average. I don't really know what crypto is, but yeah, no, I just, I've been trying to stay active reading. Certainly the volume of medical literature that we've had to go through with COVID has been like enormous. But it's been fun to kind of also let your brain relax and just kind of do, what Netflix and chill, for lack of a better.
That's actually funny. But how about, okay, so you said Sir Attenborough, but any sort of guilty pleasure things that you've been watching? Because those are also fun too.
Yeah, I really like the Narcos type series on Netflix. Yeah, I don't. There's something about, it's funny because I'm such a systems kind of guy, like, and leadership is leadership, and it's really, I'm always like fascinated by like the vast network of like organizational systems like achievements that like drug dealers are able
Okay.
to
So basically this organizational leadership system of cartels.
Totally.
Right.
Totally. And it's fascinating to me to watch. So yeah, I did really get into the narcos thing this time around. And I've traveled through Colombia. So seeing certainly the ramifications of the cocaine culture there, like really like was a really cool thing well, not cool for them obviously, but interesting thing for me to watch and understand. So that was kind of cool. That was my guilty pleasure.
You're guilty Narcos. That's a pretty good show.
Yeah,
well,
exactly.
Thank you again. And I really do appreciate you speaking to us. And also thank you for your service. I know the work that you do, you're on the front lines, is really difficult. And I know myself and everyone else in Ontario and Canada deeply thanks you.
Well, thank you very much. It's been a crazy ride, and this is what we do. So thank you very much.
Great. Thank you so much, Andrew.
You're welcome.
We hope you enjoyed our episode. Your feedback is always appreciated. You can email us at futureof19@gmail.com. You can also visit our website at www.ftrof.com, as well as follow us on Twitter, Instagram, and Facebook at futureof19. You can subscribe to our YouTube channel, The Future Of. Please leave us your comments about what you liked, what you didn't, and what would you like to focus on for future episodes. We'd love to hear from you. And lastly, if you are enjoying our episodes, if you enjoyed Season 1, looking forward to Season 2, please consider supporting us at Patreon at www.patreon.com/futureof19. Thank you very much for your support and have yourself a wonderful day.